Hello, everyone, and welcome back to our series of lessons on medicine through time. So, we are in the Middle Ages or the medieval time period. That's the time period that's going to end around 1500. And today, this lesson, we're looking at who healed the sick in the Middle Ages. So, you're sick in the Middle Ages. Who is it you're going to be going to for help? First up, though, just thinking back to last lesson, what was the main belief about the cause of illness? So, if you could go back in time, you stop a medieval person in the street, you say, "What makes people sick?" What are they going to say to you? Well done, everyone who was thinking God. So, the firm belief at this time, God makes you sick, says so in the Bible. The church are repeating that message. So, if you are ill, it is because you've sinned. So, your first port of call is going to be prayer. Praying to God, saying you're sorry for your sins, asking God to take the illness away with you. So, that's seen as the most important. So remember, this idea really holds medicine back in the sense that no one's looking for a different cause because they're so certain that they found it. So no one is sort of doing research or trying to come up with new theories because they think they've got the answer. They think it's God. So you're sick in the Middle Ages, you've tried your prayer. Who is it you can go to for more practical help? So you've got some options. Number one are the physicians. So these are men. Only men are allowed to become physicians. These men are the Middle Ages equivalent of doctors. So the word doctor only started being used a couple of hundred years ago. Through most of the course, what we would call doctors are actually called physicians. So these men are university educated. So early universities are starting, some in Europe, we get Oxford, we get Cambridge in this country. And going for a medical degree, you get 7 to 10 years, depending on your university, of studying, which sounds super impressive. Like those men must learn a lot. But don't forget what it is they're actually studying is the work of Galen, Hippocrates. So people who have not got it right. And that a lot of their knowledge is based off these works that are wrong. They, however, are literate. That means they can read and write. And this is a time period where very few people can read and write. So, including even royals. Royal people can't read and write. So, you have people whose job it is to read and write called scribes. So, you want to send a letter, you call your scribe, you tell them what you want them to write down. Similarly, if you receive a letter, you call your scribe, you get them to read it to you. So, because there's so few people in the Middle Ages who can read and write, the fact that physicians can do that, it instantly makes everyone think you're smart. So, we could all go back to the Middle Ages. They are going to be unbelievably impressed with us because we can read and write. So, the reason I put that then, the reason it's important is people don't question the physicians or the doctors. They're so impressed with them. They've been to university. They can read and write. What they say, everyone is willing to believe. Because who are you to question such an educated person? And this is such a strange point for us. They rarely met their patients, which just seems so odd to us. So if you are sick, what you would get is that picture there is what they're going to be looking at. You wouldn't meet them. You would send it off to them. You would let them know when you were born. You'd let them know the date that you fell ill. And what they do with that information is they'd look up with the astrology charts where the planets were when you were born. They'll look up where they are when you get sick. And from that, they make a diagnosis. You also send off a sample of your urine, and that picture there is what's called a urine chart. So the physician or the doctor would look at your urine, they'd look at the colour. Some of those colours are really extreme. That green on the left there, I think if your urine is that colour, that person is seriously unwell. But they look at it, they smell it, and really disgusting. They will taste it. So they will actually drink your wee and they will use that to diagnose. Now, I was talking about this with the doctor the other day, and he said, actually, interestingly, you can tell if someone's diabetic from the taste of the urine. Apparently, there's something about the sugar, the lack of sugar. So maybe there are some things that medieval physicians can tell from tasting your urine. Clearly not a glamorous job. So they don't ever really see the patients. They're not getting hands-on experience. And I put there that fourth bullet point. They are very expensive. So if you are rich, you are going to hire them when you get sick. Royalty, the very, very rich had a permanent physician sort of on the books waiting to treat them. But most people in the medieval world wouldn't go near a physician because they just couldn't afford it. So pause the video if you need to, and then just answer that last question there. So how effective is their care? You're a medieval person, you're sick, you're rocking up to the physician. What are the chances of them curing you? And actually, I think we can all agree, can't we? It's not going to be very good. Yes, they're educated at university, but what they're being taught is the work of Galen, the work of Hippocrates, which isn't right. They're not meeting patients, so they're not observing any symptoms. They're not learning on the job. So these people are not going to be able to make you any better. The next group, though, the apothecaries, are more helpful. So they mix herbal remedies. So the closest in today's world would be a pharmacist. So the apothecary or pharmacist mix herbal remedies. Unlike the pharmacists we have today, you can go straight to them. So sometimes today people, rather than go to the GP, will pop into a pharmacist if it's something that's like a minor thing they just want checked out. Same in the medieval world. Most people can't afford a doctor, so you pop into the apothecary and you go, these are my symptoms, what do you suggest? Those of you who are doing Romeo and Juliet and Shakespeare, remember the apothecary appears there and he sells the poison to Romeo. So apothecaries, mixture of herbs, also some poisons as well, which in small doses are used. So things like making you sick. So if you've eaten something that disagrees with you, they might give you a very mild dose of a poison to make you sick to get it out of your system. No formal education at all, but lots of experience. So they would have been trained from around the age of 11, 12, hands-on experience. So people coming in with ailments and then learning from other apothecaries who are like, I've seen this before, this is your herbal remedies. They are cheap, some cheaper than others, but these are affordable by most people in the Middle Ages. Okay, so they're cheap, they've got some hands-on experience. Herbal remedies, doctors say think about 25% of them would actually work. So if you think today the shop Holland and Barrett that sells lots of those are herbal remedies, some of these will genuinely work, about 25%. So same again, pause the video and just think, how effective is their care? So we're in a slightly better position than the physicians in that they have experience of seeing patients, of seeing symptoms. Some herbal remedies will work, but most won't. Most of the things they are selling will not make you any better. The herbal remedies that do, it's going to cure very mild illnesses. So minor things, it's not going to be able to touch anything serious. So if you are seriously unwell, the apothecary is not going to be able to help you. Next up, women in the home. This is where the vast majority of medical care in the Middle Ages is coming from. And it doesn't really appear much in the sources. So people don't really write about this, but most medical care is being done by women and it's been done in the home. So it's women treating their fathers, their husbands, their children, their siblings, and it's these herbal remedies. So again, 25% of them will work. They have really practical knowledge. There is no education. There's no education for women in this time period. There's certainly no medical education for them, but they have practical knowledge, like the apothecaries. So from the age of 11 or 12, they're going to start being taught the remedies, just part of the skills. So they're taught to cook, they're taught to clean, they're taught how to make herbal remedies. What do you do if someone in your family is sick? There is some superstition in there, so there's some very odd cures that will never work in a million years. But there is some things that are really sensible. So I put a picture there. This is gripe water. So today, if someone has a baby that has wind or gripe, they will go and they will get gripe water. This is a herbal remedy that was used in the Middle Ages. So we have records of women in the Middle Ages making gripe water for babies with wind. So some of it will absolutely work. I've put there nettles, so stinging nettles. So if you had arthritis, so you need to get more blood to the joints, what they would do is they would hit your joints with those stinging nettles. And what would happen then is your body would get the reaction from the sting, it would send blood to the site, and it would help your arthritis. Obviously, the stings hurt, so they'd have to take the sting away with dock leave. But that would actually help with arthritis. And last one, which some of you might use yourselves, honey is a natural antiseptic. So it might be if you've got a sore throat, sometimes people mix honey with warm water. That really will work. So the honey, natural antiseptic, it will cure your sore throat. In the Middle Ages, women are giving that. They're also putting on really small cuts and wounds. It will stop infection. So how effective is their care? You're sick in the Middle Ages, you're being looked after by a female family member. How effective is their care? And again, with this one, it's really similar to the apothecary. On certain things, they're really good. If you've got arthritis, your baby has gripe, you have a sore throat, these women know what they're doing and they will be able to help. Anything serious, though, they won't know where to start. So medicine isn't evolved enough to treat anything serious. And the last group that we are going to look at, the barber surgeon. So he will cut your hair, he will pull your teeth, he will amputate limbs. So the barber, as in your hairdresser, they've got sharp knives, they've got a steady hand. Who better to go to if you need a bit of surgery? And if you look at the pictures, I put the top one. You might have seen this. This is the barber pole that you often see outside barbers. And it goes back to the Middle Ages. So, like we said, in the Middle Ages, people can't read and write. So you couldn't write above your shop that you were a butcher or a baker. So instead, what people did is they would put pictures. And so you would have, if you're a fishmonger, you'd have a picture of a fish. If you're a tailor, you'd have a pair of scissors. And what barber surgeons used to put out were bowls of blood with white bandages coming out. So that would advertise to anyone walking past the street that they could cut your hair, pull your teeth, or amputate your limbs. And so the modern day barber pole is a nod to the bowl of blood and the bandages. That's where we get the red and white from. And you can see down the bottom picture there, so you can see a barber surgeon there about to amputate a foot. So most of the time they're cutting hair. Pulling your teeth, there is no dentistry in the Middle Ages. If you have a toothache, they need to pull your teeth. And you really do need your tooth pulled because if you have an abscess or an infection that we would cure with antibiotics, it could kill you in the Middle Ages. So you head along, they pull your teeth. Most most skulls that we find from the Middle Ages actually have very few teeth missing. So this isn't something they're doing that often because they don't have sugar. So because they don't have that sugar in their diet, actually, most medieval remains have full sets of teeth. Then the bottom one, amputate limbs. So again, it's relatively rare, but it'd be certainly a lot more common than it is today because of infection. If you have an infection, you need to cut off the limb above the infection or you're going to die. So it's a choice between having your finger or your hand cut off or dying. So think again last time, how effective is their care? So actually, surprisingly, of all of them, they are the most effective, but it's because what they're doing isn't that tricky. So pulling teeth, you need pliers and a strong arm to pull a tooth. Amputating limbs, in later lessons, I'll talk to you about how they amputate, but it would take between sort of 5 to 7 minutes. You would cut around the skin and the muscle, and then you saw through the bone. None of these activities require much skill. You basically need a strong stomach and strong arms. So, because there isn't that skill and a lot of knowledge needed, actually, they do a really great job. You need a tooth pulled or a limb amputated, these people will absolutely sort you out. But if we think overall, really, this is a terrible time to be ill. If you've got anything beyond a minor illness or something that you need pulled or cut off, you are in real trouble. And it isn't surprising, is it, that half of all people didn't make it out of childhood and that life expectancy is so low because you get sick and there really is nowhere to go to. So next lesson, we'll look more at some of the treatments that these people were offering.